Test, test, test. Test. Hi everyone, thanks for being here today. Please grab lunch if you haven't grabbed lunch yet. And because I forgot the agenda is laying on my desk next week, please use the QR code on the screen to sign in today.
There is a QR code on the screen, so please use that to sign in. And if you have not gotten lunch, please help yourself to lunch. Get yourself lunch while we get our meeting started. So we will just be eating lunch and networking until 12:45-ish. sign in on the QR code that's on the screen. If you need Wi-Fi, you can get on free Wi-Fi at Lakeside Network. So don't be shy. We'll go ahead and get started. So, since we don't have the agenda, like I mentioned, well, QR code, if you did not get to sign in on that QR code, please do that. The agenda would be welcome, and then any new attendees to introduce themselves, and then we'll have announcements and our panel. Okay, so my name is Linda Bates. I'm with Welfare Kentucky Senior Community Engagement Coordinator and also a member of the Safety Net Alliance Engagement Committee. So welcome everybody to today's meeting, and thanks for coming out in vacation month and all the heat that we've got, all the humidity that we've got out there. So why don't we right now go ahead and if you are a first-time attendee, please raise your hand and we will come to you and you can introduce yourself, which would be your name, your job title, and the organization that you're with.
Thank you. Carl Swartz, I'm with Chemical Treatment Center for Recovery Works. Probably a lot of people know. I am the Director of Sales for the organization, and happy to be here.
Awesome. Thanks for being here. I met you when you came in.
Hello, my name is Mason. I'm with KCTCS. I'm a student intern right now for them, and we're helping out with the food pantry and cultivating resources for the students.
Awesome. We're glad you're here.
Hi, I'm Allison. I work with Welcome House. I'm the housing navigating specialist. Call me, take them all time. There's just one point, so I've been there for a few years on the meeting.
We're glad you're here. And you have the most difficult job in Northern Kentucky right now, being a housing navigator. Yes.
Hi everyone, my name is Noelle. I work with Welcome House. I'm new, and I will be serving as their payee coordinator. I'm excited to work with budgets and to be here with people, so thank you.
Thanks for being here. I love the payee program. It's so important for people in Northern Kentucky.
Hi, I'm Tajay. I am the Graduate and Housing Coordinator.
Cool. I like you guys are doing a cool program with the healthcare team right now. I can't think of their name, but really cool stuff going on there. Forward Slash. Yes, that's what you're doing. That's really cool.
Hi, I'm Crystal Becker, and I just moved to a new position with Right Center. I'm now the Scholar House Case Manager.
Also, awesome work. Glad to have you. Who else is new? You are definitely not new. You did?
Hi, I'm Sarah Wright. I'm definitely not new, but this is my first time attending since I started over at Be Concerned, and I'm their Programs and Services Coordinator. And so I've only been there for like 30-ish days.
Glad to have you there. Thanks, Sarah. Anybody else?
Hi, my name is Fatu Suave. I'm representing the Central African Women Association. I work there as the community relation, and I also work my 8-to-5 job at SNA June Meeting.
Your organization is incredible. I just learned about it recently, and I'm so glad you're going to share about it today. Anybody else?
Hi everyone, I'm Raven Lendu. I'm the volunteer specialist at Kentucky Refugee Ministries Covington.
Okay, so I do have to say, and I'm not doing this to embarrass you, Mason, but I am now seeing like my children's friends out professionally, and that is just phenomenal. I just absolutely love it. So, and Mason was one of those friends, and I used to actually full circle used to be Sunday school teacher here at Lakeside Christian, and Mason was in that Sunday school class. It's super sweet. I'm so excited.
It appears as though you did your job pretty well, right?
I guess.
Not serving the community. That's pretty awesome.
So, thank you, and welcome to all the newbies. We're really glad to have you, and look forward to you coming back and continuing to learn about resources in the community. We're going to go ahead and do announcements.
Actually, that's at the end.
What at the end? That's right. I'm looking at.
Run committee reports.
Okay. Committee reports. I'll go ahead and give the report for the engagement committee. So, one of the things that we do is we plan the speakers for the meetings, and so today's topic is refugee or immigration services. In July, we are covering veteran services, and we are looking for one more person to present in our veterans panel. If you know of anyone that would be a good candidate for that or a good resource, we'd love see myself or Laura or Aaron. Laura's in the back waving. And then in August, we'll be talking about homeless services. And so we are working on planning that panel right now. We've already got a commitment for Ramon. Go Ramon. So we're glad he's with Welcome House and Forward Slash. So we're glad. So if you're interested in being on the unhoused or panel, please reach out to one of the three of us again. We also are working on Safety Net 101, which will be a great introduction series for all of the new people as they come in. And they will also not only get that introduction, but they'll also get a little gift that so many of you have already gotten in the past couple months. So that's our committee. Who would like to give, you want to give your committee updates?
Sure, I'll give the executive committee updates. Things that we're working on, we submitted our application to the United Way. If you're a praying person, prayers would be awesome. We're asking them for enough money to hire a staff person, and that staff person will not only help with administration work. What you see in everything that you see the SNA does, it is all volunteers. Mostly leaders that are executive leaders of other organizations. So if you haven't seen our website updates, all that's created by volunteers. And really, we have big dreams for what this can be. And we're kind of seeing we can't get there if we don't have a staff person that can manage and kind of keep the boat rolling forward. That person also is going to be in charge of engagement for the new care suite, United Way 211. If you haven't heard about that, it's an amazing case management system that allows us to send live referrals, track successes, and everything else. It's going to cut down on phone calls that you have to make. It's going to reduce the knowledge that you have to have. We still want you to come and have the knowledge, but the system will have logic built in as the client answers questions as to where you should send them to get help. And hopefully we'll be live, not live, but it'll be updated so that opportunities that are out of money, it won't come up as an option, so you'll know not to send them there. I know we all get frustrated where we call 3 places for something, and none of them have money left, and we wasted 30 minutes of our time trying to get through. So hopefully, we have a pilot that's starting August 1st, so we have a hard deadline for when we're starting that pilot. We're a very dumbed down version, but we're going to try to work through all the problems, figure out how we need to get it set up. And so this person will really come in and help navigate that, but also, as we go and open it up to everybody in Northern Kentucky, they'll be working with individual organizations about their complications. Just doing it with 6 organizations now, and me being a point person and trying to run my own agency is a lot. So if we really want it to be successful, we need some help. So United Way hopefully is going to come through with us on that. Then we just, I don't know, there's so much going on right now that's awesome. And we just talk about that stuff. So there you go, that's fine.
All right, thank you. Is there anybody on service integration that would like to give an update?
I know they have. No.
Please, Lisa.
Yeah, so service integration, that team met just a couple of weeks ago. I was not able to attend that meeting, but I think that everything is in line. The intake form has been created. I think that's been sent out for others to review and submit any kind of tweaking or any adjustments that are necessary for that. I'm looking forward to the all first.
No, you guys are amazing. There was an alert that went out from Chadwick about that intake form. If you did not see the alert, all of the alerts that are active are now on our webpage. So if you go to safetynetnky.org, I believe is our website, go all the way over to members, and you'll see alerts there. You can now submit all your alerts directly through the webpage, which you couldn't do in the past. Once it's approved, it'll actually go on the webpage so that everybody can see any active alerts that's there, and there will be an email that goes out. So if you didn't see Chadwick's alert, please just go to the webpage and you'll be able to find it on there.
Thank you. Okay, external relations.
That's me.
Okay.
Yeah, we have not got time to start the summer, so we are waiting still to just get rescheduled. We're hoping to get maybe a group meeting in August. I know Jenna from Welcome House and the Executive Committee is going to come on board with me and him to help us kind of steer that. But the Facebook page is ready. We're just waiting to send out a doodle poll. The Facebook page will come to everyone in an alert as soon as I remember. You guys have heard that for 2 months. So as soon as I remember to get that done, it'll be done. And then we are looking to maybe have like a safety net partner day where we get together and maybe take a look at what does that look like for external relations to have an actual get together in a space where we're maybe inviting the community and funders to come in and learn a little bit more about who all of us are our agencies. But kind of that's where we're standing now. We've set a new recurring meeting date. Go forward from there.
Can you introduce yourself to our new?
I'm Andy Brunsman. By day, I'm the executive director for Be Concerned, and in my free time, I work on the executive committee for the Safety Net and Service Integration of the Food Committee.
Thank you. And then community impact.
Yay! Somebody's here. You're always here.
I'm always here. And
Introduce yourself, please.
yes, I'm Grace Marie Thompson. I am with the Bryant Center, and I am part of the Building Community Wellbeing team as a systems connector. In my lovely free time, I do a lot of data, and so that's why I got whacked on community impact. But that's not what community impact is about. We're about celebration. So if you would like to join us to do celebration, I will take all the data. You do not have to do it. I'll do it. If you want to just be part of a really chill committee, we are meeting next Wednesday, the 25th, I believe, at 11:30. Virtually. So come join our committee, please. We'd like some extra numbers.
Can I add on to that?
Yeah, go for it.
So adding on, they are tracking some data at this point. We're hoping that Care Suite is going to make it better. But there should be an email out probably in the next month or two going to executive leadership asking for numbers from the previous year so that we can pull together collective impact of what our SNA partners provide to our community. That's important, you know. We talk a lot about, so I'm Aaron Bruno, Executive Director of Faith Community Pharmacy. We talk a lot about, at Faith Community Pharmacy, we're the largest charitable pharmacy in the state of Kentucky. So we've gone and advocated for laws change. And sometimes when we go just as little Faith Community Pharmacy, it's hard to get our voice heard. But if we go and we have the Safety Net Alliance saying, hey, these partners in northern Kentucky create $300 million worth of impact for low-income people, and it's probably more than that. And we all come behind and say, hey, we've got to set Faith Community Pharmacies back. This needs to be done so that northern Kentucky can be better. That's where the impact really makes a difference. So I hope you encourage your executive leadership to ask about that. They are also working on end-of-year awards. It'll be our first awards. Two things that are really exciting about that. One is that we want to celebrate excellent collaboration and excellent partnership that brings better outcomes to Northern Kentucky, individually and organizationally. Two, if we continue to want to have a bigger voice in our community, the community needs to know who we are. And a great way for them to know who we are and what we're about is by giving out awards and making a press release. And so it does have a double impact of what we're doing. So when the awards come out, so they're going to ask for nominations, please nominate.
Thank you. And then the affinity groups, I'm just going to kind of try to list those off, and I might forget, so I'm open to help, but there is a healthcare affinity group, and there is a housing affinity group, food, and a food affinity group. Is there anything else that I'm missing besides these three?
There's more. There's a work supports affinity group. We are trying to get a student service affinity group off the ground, but we need a leader of that. And we are trying to get senior services affinity group off the ground, but we need a leader. We already have many people that have signed up and said, I want to be on that group, but we haven't had anybody say, and I'm willing to lead.
If you would be interested in serving on any of those affinity groups, just reach out again to Laura or myself and we'll get you connected to those. And Laura's in the back waiting. So, okay. So I think without with doing the announcements at the end, I think that takes us to our panel. And if you guys would like to come up to the chairs of I'll go ahead and do a quick introduction. Today we're talking about refugee services, immigration services. So we have Kristen with Refugee Connect. We have Wilson, who is with Kentucky Refugee Ministries, and then we have Fatu, who is with the Kentucky African Women's Association, which I can say I have had the opportunity of working with Fatu on a couple different projects, and I'm super excited that you're on our panel today. Thank you guys for joining us. If you would like to go ahead and tell us a little bit just about yourself and maybe how you got to where you're at right now.
Good afternoon. Thank you for inviting us to speak about the support services that each of our organizations offer to the immigrant community living in Northern Kentucky. I'm Kristen Burgoyne. I'm the Executive Director at Refugee Connect. So we're a local private nonprofit, and we actually started as a project with the Junior League of Cincinnati. And in 2011 and 2012, they did a 2-year needs assessment looking at gaps in services for the refugee community across greater Cincinnati, including Northern Kentucky. So we were formed to address those gaps, and then in 2019 we became an independent nonprofit. I became executive director in April of 2020 during the beginning of the pandemic, and we pivoted our services during that time to be more responsive to the refugee community living in our region. So primarily before the pandemic, we were co-located in schools, but now our model is utilizing community health workers and what we call community navigators to work directly in the communities where refugees live, providing them with guidance to access different resources, services, and organizations that might support things like housing, employment, healthcare, things like that. We also still have a presence in schools. We have a college and career readiness navigator who works in both Cincinnati public schools, but also at Boone County High School. And she supports seniors as they're going to navigate post-secondary opportunities. Over the last year, we've supported 323 families. We are in 6 counties in Southwest Ohio and also in Northern Kentucky. And our families range from having only lived here for maybe around a year to some families being here a lot longer, 5 or 10 years, but still needing that navigation support so that they can become financially stable and be able to thrive here. The average length of time that somebody will work with a navigator is about a year, so we don't have caps on the length of time that somebody can work with a navigator, because we understand that the long welcome exists here and that families are often coming with language barriers and other kinds of cultural barriers that might prevent them from fully integrating into their communities in a short amount of time. So that's all I'll say for now about Refugee Connect, and I'll pass it to Pat.
Thank you. Thank you for inviting us. I was happy to walk in. I didn't know who I was doing the panel with, but I was like, oh, Kristen and Wilson, my favorite people. Amazing. They're doing an amazing job. So, Kentucky African Women Association started about 11 years ago. We created just to help each other. We are here without no family. So we realized when somebody have a baby shower, it's just maybe husband, wife, and kids. So we're like, okay, let's try to get together and see when somebody have a baby shower, we just go ahead all together and show up, cook, bring food, and then when they have wedding, graduation, and then we start with a picnic for the kids, and then we start realizing that people are sending people to us to help with application for anything that they need, housing, food stamp, jobs. So we start connecting resources with people without even realizing it, because we know the people who are here 10 years or more might know better than the one who just arrived. So we try to have this translation and stuff. So when we say like about 8 years ago, why can't we do this non-profit so we can help more people? So that's when we became the Kentucky African Women 501c3. So right now, we started going to the library. We didn't have nowhere. So we had to rent a room to the library, and we let people come in, and we help them with translation, reading their letters if they can understand, and also help them with applications, especially job applications. And then that opened a way for me to start working for an agent, a staff marker, like a recruiting agent, and it was making it easy for me to put the immigrant to work, which is the most demanding part of immigrant people. So that's how Kawa is started. Right now, we still helping people, but we adding like a culture awareness. So every year we have a culture day. And now, soon you're going to see the name change a little bit, because we're going to change it to African Women Alliances, to welcome all women inside instead of just African.
Hi, my name is Wilson here. I am the Resettlement Director for Kentucky Refugee Ministries. And I was actually panelist for 2019, right before the pandemic. In my previous position, I was the Director of Community Impact for the Kentucky Compass Compact, and I explained a little bit about the district program and so on. But anyways, thank you for having me once again. We opened our office full time in 2021, right before or after the Afghan graduation. So we first started providing services to Afghan refugees coming into the country. And we had the opportunity to partner with Refugee Connect and other community members as a task force to start providing those services. Since then, we have expanded to provide services to multiple nationalities, refugees from multiple nationalities coming in. And since 2021, we have served over 800 clients. And we have an amazing team that provides case management, housing services, employment services, youth and school support. We have a small mental health program as well. And I would say that the last 6 months have been very tough for us. We have lost multiple staff members. But those 800 clients are still here, still need our support. So we are working strong with the community to make sure that we continue to provide the services that are vital for them.
Thank you, guys. So we'll go over the questions that we kind of had sent to you, prepared, and if you feel like you've covered it, you don't want to add anything else to that, then that's okay, but if there's something that you want to add on in, then okay, go for it. So, what is the driving need for your services that the community needs to be aware of?
Yeah. I'll start by saying, just like I mentioned earlier, a lot of folks in the community asking, well, now that refugees are not coming in, what is the purpose of the organization, right? As a refugee resettlement, we welcome refugees, but I always say that we have already welcomed 800 clients, and those 800 clients still need our support. So just for perspective, out of those 800 clients, the caseload is about 4 to 5 individuals per family. And those families qualify for services up to 5 years. So the funding that we receive from the state is provided that service to make sure that clients are fully integrated to the community. So although we have a small staff, we are here to support them. And there are families that have significant barriers. Just imagine being, a single parent with 3 kids, don't speak the language, it's hard to get daycare. So on and so on, right? So you guys have those cases, or those type of cases in the community. It's just that our clients are new to this area. So they have us, they have you, and it'll take a little more effort to get them integrated and successful in the community. So I would say that that's something that I'm always praising. We need your help. We can do what we can. Our staff is in some ways experts in providing services, but we rely on the community to make sure that our clients are taken care of when they're out. And one more thing I'll say is that our clients, we try to get them confident to be self-sufficient. It takes a welcoming face, it takes a welcoming environment for them to feel safe to go to get health care, to go to a parent-teacher conference, right? To go to a program, right? So we try to advocate for the community to be welcoming to our clients, just so they can gain that confidence and be self-sufficient.
To add to what Wilson was talking about in terms of refugees that are living here in Northern Kentucky, even prior to the establishment of Kentucky Refugee Ministries in Covington, there were groups of refugees that were resettled in the area, mostly secondary migrants coming from other cities or states. And so even though refugee resettlement is currently paused nationally, there might be refugees who are living in other cities or states who migrate into the area. This region is desirable for secondary migrants because we have a relatively low cost of living. There are job opportunities for people who maybe aren't proficient in English, so manufacturing jobs, things like that don't require a high level of English proficiency. And because there are already established communities that are living here. For example, in the Villa Hills area, there is a group of Pakistan, who are an ethnic group from Burma that has been established here for at least 10 years. And so as they may have family living in other states, those family members may be moving into the area. Additionally, there are other immigrants that are living in Northern Kentucky, and there's actually been a pretty significant increase in immigrants in the region in the last few years because the government had established these family sponsorship programs of welcome circles under the Biden administration. So there were special populations of people who were provided what's called temporary protected status or humanitarian parolee status. And so they were able to arrive in the United States through those programs. One population being Venezuelans, but there's also a Cuban and Haitian program. And so we saw an influx of immigrants from those countries coming into Northern Kentucky. I think we helped 200 plus patients in just in one fiscal year, so that kind of gives you an idea of the influx of immigrants in our region. With those populations come needs, because they often arrive with language and cultural barriers and a lack of understanding of U.S. social systems and how to navigate those systems. Part of the reason why Refugee Connect was created is because that community needs assessment that the Junior League of Cincinnati conducted in 2011 and 2012. What they found is that there was two things, really. One was a lack of coordinated services among organizations, service providers, employers, and healthcare providers for streamlined referrals for families that were seeking services. And two, refugees were not educated about how to access those services and organizations. And so Refugee Connect started this program called the Refugee Empowerment Initiative, which no longer exists because groups like this now exist, which is wonderful. But the Refugee Empowerment Initiative in its early years really brought together all of those service providers and healthcare providers and employers to start talking to each other and to start finding solutions to how they can better support the community. And Refugee Connect, on the service side, provided support to families and helping to educate them about how do you make a doctor's appointment? How do you manage your prescription medication? If you have a chronic medical condition, what does that mean and how do you manage it? Because a lot of refugees and immigrants have very little access to health care in their home country, or it's very fractured, or it looks very different. And so many of them come with unmanaged chronic medical conditions. They don't understand, for example, why do I have to keep going back to the doctor? So they will, healthcare providers will experience things like people not doing follow-up appointments. And part of that is the education piece. So we would provide that education to families, but we also go into those organizations and institutions and we provide free training to the provider. So how can you be more responsive to refugees and immigrants when they're walking in your door asking for services? Because part of it is making sure that people have access to the services. And it's not enough to just educate a refugee about a service if they walk in your door and nobody knows how to help them. So we can provide that training as well.
All right. What I'm going to say is closer to what they say already. We offer almost the same services, but Kentucky African Women came where the people who don't have nowhere they go. They're not refugee, nobody taking them, and they're in the limbo. So we are able to help them, guide them, and send them to the right place for work or anything that they need. So we will love to work with employees to open the gap for the language barrier so we can help them work, and we even are able to come in and talk to them and have a first day orientation with them and explain everything in the same language that they speak so they can understand what they're doing at the first day.
Thank you. And speaking of language, I know when I'm tabling at events, depending on the event, I try to have language friendly literature. So if you could just, what are some of the most common languages that you are working with? Could you share that with me?
So for Kentucky African Women Association is, I know nothing in this room, but most of the people when they hear Africa, they just think about Swahili or they think about Arabic or French, maybe Spanish sometime. But everybody have their own little language from their country. Like I speak Wolof, I don't speak Swahili. But I also speak French because it's my school language. But however, if you grow up in my country and you never go to school, you will not speak French, you only speak Wolof.
So Wolof is very popular in the Cincinnati area right now, just because of the refugee that came in last year. So Mauritanians speak Wolof and Senegalese speak Wolof, Ghanaians speak Wolof, and we have a lot of them came a couple of years ago. So that's a language maybe we can consider that I don't see much is Wolof, but I have to give you guys a shout out that I'm seeing a lot of big difference when they have the different languages on tables when I go to job fair or when I go to, community fair. I'm seeing different language more and more now.
I think Fachi made a great point that just because someone is from a certain country doesn't necessarily mean they speak the language of that country, because there are a lot of local languages or tribal languages or even dialects within languages. In Kentucky, I think we see a lot of Spanish speakers, but Spanish may not be their first language. We also see Chin speakers, Arabic, Swahili, Lingala, French, Nepali, and they're primarily in Cincinnati, but those are kind of the larger groups, language groups. While having multilingual literature is really helpful and important, please also keep in mind that someone may also not read in their own language. But any information that you can give them, even if it is in English, or if it is in their language, if they can't read it, they can often take it to somebody in their community who can. And then if you are working with interpreters to provide a service, we always advocate for trained interpreters through language access programs and companies who, that's what they do for a living, they certify people to become interpreters. And to make sure that you know the region that someone is from, because even within regions, in Africa, for example, like they may not understand each other depending on the region they're from because of dialect. So it's always helpful to understand what country they're coming from if you're getting a trained interpreter, because if the interpreter doesn't speak their dialect, that's not helpful. They're probably not going to be able to communicate or communicate effectively.
Yeah, I will agree with the languages that they mentioned. Some of them that we work with as well as the African, Pashto and Dari. And a good point that Kristen made about different dialect is the Chimbernese population in the hills. This big Hakka Chin, there's also Chin language, so you have to really know the language that the dialect that the clients are using.
So it's not an easy answer. It's not just one
Hey, Linda, can I add a question? How, hopefully all of us are leaning on AI at this point. How effective are you seeing AI models at translation to be able to get, is it bad? Is it better than nothing? Where are we at with that when we're trying to create flyers, documents, and all that stuff?
I would say that we make sure that we always get a licensed translator that will translate our documents and send it in and send it back to us and certified in good translation. But I see last year that our ESL instructor was using AI to interpret right away some of the lessons or some of the instructions she was giving to the clients in the classroom. Because in the classroom we will have individuals that will speak multiple languages, so it'd be difficult for her to get an interpreter at the time. So if you want on-demand interpretation, multiple languages, AI could be useful. I've seen it being used in the classroom. But I would still personally just make sure that you use a certified person that can translate the documents.
Can you say again what our organization uses language line for live interpretation?
Mm-hmm.
Who do you use for translation services? For document translation services.
This might sound bad, but I just ask someone at the office to send it in, and then it's in there. I forget the organization.
I feel you, Wilson.
We use Propio, that's one of the language services. And the thing with the certified translators is they have to pass a test. So they have to go through a certification to show that they're not only proficient in reading and writing in their own language, but they're also proficient in reading and writing in English, which is super important if you're having really important documents translated, like healthcare forms or IEP forms for schools, things like that. So I think depending on the situation, the context of the situation, it might be okay to use AI in ESL classroom if you're trying to help someone understand the lesson, because the content might not be super confidential, or you may not need them to there might not be a lot of technical jargon, and when it comes to translators and interpreters who are certified, they have different certification levels too. So there is a difference between a medical interpreter and translator and a legal interpreter and translator. Those are separate specializations. So those translators and interpreters have to have specialized knowledge on medical vocabulary or legal vocabulary. And so there's even specializations within those certifications. So I think, if you meet someone at the grocery store and they obviously look like they need help and they don't speak English, you can use AI to have a basic conversation with them. I think that's totally fine. But if you have a medical form or a mental health form that you're trying to get someone to fill out, if you use AI, you might be losing a lot of things in translation. And interpreters and translators also know the cultural context of their community, so when they interpret and translate, especially translation of documents, they're going to be able to say, this term, actually, there's no word for it in my country, so we have to figure out, or in my language, so we have to figure out, how do we make that vocabulary translatable?
They say no? Thank you. Thank you. What are the primary challenges or barriers that are currently hindering the effectiveness and impacts of your programs?
So my first one right now is a language barrier that we're having. Before it wasn't a problem in Northern Kentucky. We have this client that need job right now. They are legal in the United States, but they're not speaking the language. Even though if you write something in French, they're not going to understand it, even they from Senegal or Mauritania or Gambia, because they went to school with Arabic. So they only can read Arabic writing. The second one, I was just telling Christian on the table, I said, I didn't think some of the grant will affect the Kentucky African Women Association, because we never asked for grant in our life. We always use our pocket money. However, we used to connect to our people with resources. And some of the resources now cannot help them. So we're like, oh, wow, we don't really need this, but we really was working behind the scene and needed that thing. So it's just very difficult right now. So all of us have our monthly salary. We know that we hardly can live in it, and it's always hard to go back to woman. It's 8 of us, and we're like, hey, can you give $25 to buy this person a mattress? So it's at the end, it's just being so embarrassing to ask people all the time for money, which is they still giving, thank God, but I know it's, they are going to the end to try to help these people, and it would be nice to have some resources or new resources that can help those people.
I think to go along with what Fatu was speaking of when it comes to funding, so, Kentucky Refugee Ministries and Refugee Connect have both historically benefited from federal grants, which are no longer available. So that loss of funding has caused layoffs at organizations that maybe traditionally were able to have services beyond just resettlement of refugees, or we had a school-based program where we were able to go into the schools work with wraparound services to families and students that attended those schools. Besides like the logistical barriers that refugees face because of language and cultural barriers and nuances, affordable and safe housing, transportation issues, childcare issues, accessible language services. I think those are all real barriers that all of our clients face. I also would say it is politically it's been very challenging this year, obviously. We have kind of created an atmosphere of distrust within the immigrant community. They're very afraid to access services right now because they're unsure when they go to a physical building what will happen, regardless of their immigration status, because of what we are seeing with ICE raids and well, especially with ICE raids, because they're not just picking up people who are criminals who are undocumented, they actually don't distinguish someone's immigration status. So we're actually seeing people who are here legally with green cards or other lawful immigration statuses that are getting detained. So I think that has caused a lot of fear in the community amongst all populations of immigrants that are living here. And then also, I think just, and you all are in social services, so I don't think this is like, I'm probably just speaking to the choir or the church, so. These are people. They have families, they have dreams, they have lives, they want their children to have a good education. They're contributing significantly to our economy. They pay taxes, they hold jobs, sometimes multiple jobs to support their families. Many of them have fled very horrific situations. Even if they are not here on refugee status, we have many asylum seekers living in our community who were not afforded the opportunity to apply for refugee status because it wasn't available to them. That does not mean that they have not experienced similar traumas. And when you have to flee your home, it's not like you did that by choice. And many of these families came here for a better life, and for an opportunity and for a chance to live. And what we are seeing now is very unfortunate because we are ripping families apart. And there's something that I always remember from a conversation I had with a young person when I lived and worked in Louisville. And I asked her, what would you like people to know about you? And she was a refugee from Iraq. Her and her sister survived the bombing of their school. All of their friends died. And her parents fled with her and her sister to the United States so that their daughters could have an education. And she said to me, before I'm a refugee, I'm a person. And I think that if we strip away the titles that we assign to people and the labels that we assign to people, and we see the humanity of the individual, and we work as a community to help those families feel welcome, know that their neighbors are here to support them, know that when they walk into your organization for a service, that they feel like there's someone there who they can trust and support. That benefits everybody in our community. Okay, I'm going to get off my sentence.
Stay on. We agree.
Yeah. I just think, if I've been doing this work for 15 years, I've been working with immigrants and refugees my entire social work career, and I think the thing that I really value from this community is the hope that these families bring with them, regardless of the circumstances under which they arrived here and the things that happened to them prior to arrival. They come with this great abundance of hope. And that gets me up every day to do my job, because if they can imagine a better life, then I can imagine a better life for them. And so I think work together and collaborate together to ensure that these families have access to the resources and services that will allow them to be thriving, contributing members of our community. Okay, not really into this.
Well, it'll be hard to follow that, but what I would say for KRM, I'll just share it. You know, we started the year with 22 employees, but now we have to reimagine ourselves in the future. So right now, by August, we will have 9 full-times and a part-timer. So as an organization, we are doing some strategic planning to see how we can continue doing the work that we do at a high level, but also with volunteers and community collaboration. So that's where we are. That's the challenge that we are given, and we try to meet the moment for our clients.
I just want to add a little thing is when you see an immigrant that even that need help right away, they are looking a door to help another in the future. They are here to give, they're not here to take. So considering this, I can talk about myself. When I come in here, I have food stamp, I have housing, I have everything, but my goal was always, how do I get out of food stamp? How do I get out of things? How can I help this person get out of food stamp? Housing, now I have my own house, I have my own job, and I don't need any of those, and I'm giving back to America. So we are here to give. We might need a little window to get there, but as soon as we get there, you're gonna see we're gonna do better.
Thank you guys very much. You guys have talked a little bit about community organizations and how local organizations can help. But if there was anything that you have not said about how you can benefit from or how you would like to see local organizations partner or help your clients.
I'm gonna start with what you guys are doing right now. It's amazing. So I hear about this last month. I'm like, oh, I didn't know this happening in Northern Kentucky. I'm sorry, guys, but I always go across the bridge to do stuff like this in Cincinnati. So seeing it here, I was like so happy and so amazed with it. Unfortunately, I was not able to come and see my good friend Fabricio last month. But I hear that they did a great job last month for the health. So this collaboration is amazing in Kentucky because when I think about Culture Day, for example, is a culture awareness. So we decide, hey, we want a culture awareness, and then Cincinnati opened their door. I have a big place for you guys. Do you want to do it? I'm like, no, I want to do it in Kentucky. I want something happening in Kentucky. I just don't want to take it there because it's easy. We have AfriFest there. We have, Izanadi, Asian Food Festival. We have a lot of Cincinnati Food Festival. We have a lot of things going on, but I never got invited to something here. But I didn't realize we even have Juneteenth in Covington. That's been going on. Because I opened the door to Kentucky to do the Culture Day, people know about the African Women Association and start inviting us to stuff that we can collaborate and engage. So this here is an amazing opportunity for us not to say stuff and do a pattern and walk away and stop there. We have emails, we have communication, let's keep on going with it. Let's do what we need to do to keep engaging and working with each other because all our organizations can help us in little somewhere, somehow. For example, today somebody talk about meeting somebody at the store or somebody working in your office and they don't speak the language. We have 80 women in our organization and each one of them speak 5 or 6 languages. So I will find someone who can translate right away. And this is not even like, oh, hold on just a minute, somebody be right back with you. It's gonna be, hey, Fatu, I need somebody who speak Halpula. Hey, Fatu, I need somebody who speak Arabic. And I will find in the next 1 minute to 2 to that person to talk to you and help you. Thank you.
I can give you like a really great example of what like really supportive collaboration looks like for organizations like ours. So Wilson had mentioned Kentucky Refugee Ministries became established in Covington in 2021, and during that time, if you remember, Afghans were evacuating into the Kabul airport to escape the Taliban, because they had taken over the country, and our military did a mass evacuation of, I believe, 75,000 Afghans onto U.S. bases abroad and in the United States, and we're processing them as refugees. And Kentucky Refugee Ministries, in its early days, really wanted to support the Afghan community and to help resettle them into northern Kentucky. But they were still in the process of formalizing here in Covington. So the executive director in the Louisville office reached out to me. I actually used to partner with him when I lived in Louisville, and he said, we really need to help so that we can make this a reality. So Refugee Connect, CAWA, the Northern Kentucky Chamber of Commerce, different employers, healthcare providers from St. Elizabeth's, the library, all these different organizations came together weekly. We met virtually to help problem solve and to plan for the arrival of these first refugees who would be resettled here under Kentucky Refugee Ministries. And I won't say that it wasn't without issues or challenges, but I think if those organizations had not stepped up and come to the table, it would have been much more difficult for Wilson and his team to do their job. Those individuals that were at the table who were representing those different organizations were able to provide them with contacts for employers who might want to employ them, for options for rental, housing and rental assistance, or not assistance, but helping them find housing, and getting them connected to different services before they even arrived. And so once they were here, that was already in place for them, and the organization didn't have to scramble to figure out how do we find an employer who's willing to hire them, how do we find a house, because they get like 2 weeks notice, maybe sometimes less than that before someone arrives, and they have to have housing in place in those 2 weeks. And they were able to mobilize volunteers because those organizations were able to reach out to their own contacts to find people who might be interested in helping this community. So I think that type of deep collaboration is really important, especially for immigrant communities, because of the additional barriers that they face when they arrive here. It takes work, and it's not easy, and it can be frustrating. But I think that the initial time and energy investment on the front end really translates into a good return on investment on the back end, because once you have a system in place, it's much easier for people coming after those initial families that you're supporting to be able to access services.
Yeah, I am very appreciative of that time that Christine is mentioning. It was only me and 2 other staff members that needed to welcome people, set up apartments. So everybody did collaborate to the table, but they also volunteered their time to welcome people to the airport, take them grocery shopping, show them how to take the bus, and so that was a big collaboration that we had with community partners. One thing that I would say is, it's important for your organizations that they have, a coalition or a committee, just invite us to the table so we can represent our clients and advocate for them. An example of that was NKY. They did some focus groups last summer. They invited us. I participated in the family engagement committee just to provide my input on how they can, or school districts in Lake Kentucky can engage our families and how they can approach them when it comes to family engagement. Another good example is St. Elizabeth. They have a committee focused on improving services and access to health services for Latinos and Hispanics. I'm part of that committee. I'm providing my input. I'm advocating for our clients. And at large, overall, we are advocating for all the folks that live in Northern Kentucky, right? So our clients now live in Northern Kentucky. They are your neighbors. So St. Elizabeth is opening their doors to them. That will be in some ways easier for you and your families to also access those services.
Okay, thank you. And again, you guys have shared some positive impacts that you have had, but is there any other recent positive impact your organization has made, or a success story that you have with a family, or anything that you'd like to share about a win for your organization?
Well, we have multiple great memories. I always like to say, I live in Covington, so I always like to say that when I'm walking around with my child, I have a 7-month-old, and I go to Kroger, I'm in around Covington, I see the families live their lives. For me, that's a success. They are being good neighbors. They're going to school, going to work, taking the bus, or Kroger. To me, that's a success. They are living their lives comfortably. Another success story is we have a high school graduate from Holmes. He graduated with honors, and he is an advocate for his fellow students at Holmes, and they love him at Holmes. I also see him working 2 jobs and doing his best as he wants to be a medical doctor. So that's a success. He came in, he was one of our first families that we received in the summer of 2022. His family's doing well, and he's thriving.
So Wilson lives in Covington. I live in Bellevue, and Bucky lives in Beaver, so we're all in Northern Kentucky. One of the success stories that I can think of with a Kentucky family that we support actually came, their success is due to, the family themselves and the hard work that they put in when they moved into Kentucky, but also because we have the collaboration of the local church that had this old manse on their property that was not being used. And so they renovated the home and approached us about housing a family, rent-free, utility-free for a year, so that family can focus on financial stability, so that they could get to a place where they would be able to thrive on their own. So we moved an Iraqi family of 7 into that home. They had only been in the country for 2 years at that point. One full-time employed person out of 5 working adults, 1 car, nobody could speak English. In the year, we actually extended their living there for a year and a half, but within the year and a half that they lived there, all the adults are now full-time employed. Some of the adult children were actually competitive swimmers in Iraq, and that was something they really missed doing. So 2 of them were teaching swimming as a paid job. 4 of the adults got into the Northern Kentucky Education Scholarship Program, where they could take English as second language classes. So they now are proficient in English, and one of them graduated out of that program, is now at NKU to become a nurse. The mother was a seamstress, and we were able to get her a sewing machine so she could start to work on sewing, and we put her through a program called Stitch so she could find employment opportunities doing what she loved. They now have 3 cars. Everybody that can drive is a licensed driver, which is a big deal. They just closed on their first house. And they are living in they chose to stay in Northern Kentucky. I think they're actually in Peabody.
Oh.
Yeah. So they loved Northern Kentucky so much. And they said They were living in Cincinnati before we moved them into northern Kentucky. It is the first time in their life that they ever felt safe walking down the street. And they loved to take evening walks, and that was something that they really cherished. They were living in Crescent Hills when they were living in the church manse. They said their neighbors were so welcoming and polite to them. The church was very kind to them and volunteered with them. They felt like they were part of a community, and that's what they loved the most about Kentucky, and that's why they chose to remain in Kentucky. So that's ours.
Thank you.
I don't keep track to the people I help, so we just do what we can, what you can come to do, and we let you go. My success story is me walking to Walmart to pick up one thing, and I'll be there 1 hour because multiple people stop me to say, hey, thank you. I have a job now. I have a house now. I have where I put my keys. I have a car. I just buy a house. I just buy a car. So that's my success story. When I'm walking with my kids, they like, oh my God, don't ever go to Walmart. Don't ever go to Kroger's, Mama. Because everybody knows her. And like, I didn't even realize that until I am going for the first time to the June at Covington. And the lady said, thank you for the juice that you made for me. I'm like, what juice? He said, oh, we have an organization, somebody connect us and you make some free juice for us. I'm like, I don't remember that, but you are welcome. But when she said the name of the juice was Bissap, I said, yes, I definitely make that. Yeah, so that's my successful story, is me walking in the street, even though I'm ready to go back home and I'm stuck with this amazing person that have a good life going on with them because they passed by the Kentucky African Women Association.
Thank you. So that's it for our panel today. Can we give them Thank you very much. If you would like to get their email addresses, I think that's something that engagement committee we can add as email addresses with their names on the panel. But do stop and get their email address if you'd like to reach out to them in any way after today.
Their email addresses are on the agenda that are sitting on my desk right now. So yes, please ask them for it, and we will try to include it in an email that we send out. I apologize.
Okay, thank you, and you guys are free to drink some water and get some more pizza. Now it's announcement time. All right, who's got announcements?
I have an announcement, like all times. So next week, not this week, but next week, on Tuesday and Thursday at the Newport branch of the Campbell County Library, the building committee will be credentialed is hosting a brief 211 care speed demo. We'll also be talking about Connect and some other really cool technology for engagement. So if you want to see what that care suite looks like, it is out there. It's on the alerts page. I know that for sure. It's sent out, I think, last week, if not the week before. But there are still plenty of free spots. If you want to look at Connect or 211 or Care Suite, we will have trainers there to show you what that looks like.
That's cool. I think everybody should go, but especially if you are a small organization that does not have a CMS system, which is a client management system, which I know a lot of our small nonprofits can't afford. Care Suite is a free CMS system. So go check that out.
It's next week, so it's on Tuesday and Thursday.
Next Tuesday and Thursday.
There's one in the morning and one in the afternoon. Tuesday is the afternoon one, Thursday is the morning.
Check out the alerts page on Sick Balance.
I'm Maggie. I'm with St. Elizabeth's Community Health and Partnership, and I want to promote our C-Test Treat event. That is a cancer screening event for uninsured women, and it will be October 11th this year. I have saved the date flyers, and one side's in English, and then for half of them, one side's in French, and half of them have one side in Spanish. So if you like one of those, feel free to come over. I'm also planning on sending those out as a safety net alert. If I can figure this out, I will get on that.
I am 100% confident.
It is not.
It's a Google form now. It is so simple.
I will do it. But anyway, so I have those over there for anyone who's interested. I also have a card, and we'll be sending out save the date flyers soon too. So October 11th. Thank you.
I will go ahead and give an announcement, if anybody else, raise your hand if you have one. But you will see on your table, there is the Community Health Champions flyer. There are so many wonderful people in Northern Kentucky doing work to make lives better. So I would just really encourage you to nominate anybody that is going above and beyond and just really making a difference in the community. So please take an opportunity to think about that, chew on it, and come up with some phenomenal people. And then just a side note, so there's 8 regions, and I'm trying to get the most nominations in my region. So any help you can give me, then that would be great. So thank you. And who else has got any announcements?
Hi, sitting in my office currently is, I actually don't know what they are, but they're like a liquid protein, it says IV or tube ready. It sounds like it's something that was donated possibly for our elderly, so that's all like a liquid diet. I have a ton of them, and I submitted a safety net alert, and I never saw it back. So, if your organization wants them, or your case manager is like, I have somebody that needs something like that, please contact me.
Contact the Senior Resource Center. That's how I call it. And resubmit the safety alert.
Are there any other announcements?
Could you share the picture of what it is?
Can you share the picture of what it is on the safety alert?
Yeah, I can do that. Okay.
This time I promise it will go out.
Yeah, like if it's a tooth feeding, it would be helpful, like what product it was.
Yeah.
So if you take a picture, it might be easier.
Yes, thank you.
I apologize for the momentary lapse in safety net alerts. We lost our admin and there was complications as we were finding a solution. So I will take personal responsibility and apologize to all of you that were ones that we missed.
And you have an announcement? Okay, great.
Hi guys, Christina with the Pier in Newport. Maybe some of you have received my email. I'm still new to this position, so I sent like a mass email to 500 people the other day. Not sure how many actually got it. The Pier is having our second annual back to school bash on October 2nd from 12 to 3. We're giving out free school supplies, raffles, ice cream. We've got a live band playing. If you would like to participate and have a table at the event, please reach out to me at the Pier. I'm sure I can get an email address out there somehow. So far, we've got 5 that are willing to set up tables. We'd like to get more for the resources for the community. Thanks.
Submit a safety net alert.
Yes, we've got it.
Then it'll go out to everybody. How did mental health on Maine go? Or I'm not. Good. I'm glad to hear that. That's all.
Campbell County Rotary Alliance is doing prevention in the park in Bellevue at the Bellevue Beach Park August 9th. And that will be 9 to 11. It's a story walk, and 11 to 1 we'll be cleaning up a couple different parks. So if you live in Campbell County and you'd like to come out and join the park, or even if you don't live in Campbell County.
I want to know something, and I'm not even part of it. I have a paper here, but I'm not the organizer. But the June Meeting is happening in Florence at the Nature Park tomorrow, from 12 to 6. If you want to come by and look at it, it's done by family. You know them, right?
I do not.
Yeah. Family by family. Stop by and meet them. They're amazing, mama and daughter and grandchildren organizing for the Kentucky family.
That's awesome.
Annie, one over there. Right over there.
Hey, Taylor here from Isaiah House. So I don't have any updates for events for Isaiah House, but I did see that the Blackboard Project that we posted today that they are having a recovery prom. It's 18 and up, no children, $25 a ticket. and she's also looking for sponsors for her event. You can go to theblackballoonproject.com and check it out.
You said black balloon, right? I only know it because I read it. I didn't hear you right, so at first I thought you said Black Balloon Project. Okay, Black Balloon Project. What do they do? I've never heard of it.
It's overdose awareness.
Awesome, overdose awareness. That's really awesome.
Okay, one last call for any announcements. Okay, terrific. Thank you guys for joining us. I hope you found today helpful, and we'll see you next month. And if you know of anybody who will give a speaker or veteran Thursday,